just seen a news report about the Ebola outbreak in West Africa. There has been mounting concern in Nigeria because a man reportedly died upon arrival at Lagos airport. The Nigerian Health Ministry has been quick to point out that the man is not Nigerian. In fact, the Daily Mail reports he was an American citizen. But that has caused considerable concern because Lagos is Africa's biggest city, very densely populated city. It has a lot of public hygiene there is a serious problem, so there is mounting concern in Nigeria, and the Health Ministry has went out of its way to try to calm fears. There was also a report that a woman from Sierra Leone, I believe, who had contracted Ebola, had been forcibly taken away by her relatives. There's a lot of superstitions in the area about where Ebola comes from, about various different things. I watched a Vice report whereby there is speculation that the virus is carried on monkey meat, although that hasn't been proven. But there's issues like, for example, when people are preparing bushmeat, and if they get cut, then it could be contracted that way, almost like the AIDS virus in that sense. I should say I'm in no ways an expert on medical issues, on viruses, on that sort of thing. I'm purely a layman commenting on this. But according to Wikipedia, a total of 1,201 suspected cases now have been reported, with 672 deaths. This is by far the deadliest Ebola outbreak ever. I believe the second deadliest was in 1976 in Zaire, now the DRC. That outbreak had 280 deaths. There's been a few other serious ones in the last 10 years, but this is by far the worst. And it's so far impacted, I believe, 4 or 5 countries: Guinea, Liberia, Sierra Leone and Nigeria. And a number of charities are involved in trying to deal with this: Médecins Sans Frontières, the Red Cross, Samaritan's Purse. The lead Sierra Leonean virologist trying to stem this was Sheikh Umar Khan, and he himself died recently from that. I have a lot of respect for the doctors on the ground trying their level best to do something about this, but it's certainly a serious situation. There's a few, by the way, I should say there's been no excess deaths in Nigeria of Nigerians, so it's not so far as impacted as much as Guinea, Liberia or Sierra Leone. The virus is also being called the Guinea Ebola outbreak, because that's where it began, but clearly there's a serious potential here for a pandemic. I'd like to say a few things though about that. I remember 5 years ago when the Mexican H5N1 flu broke out, bird flu. That caused significant panic around the world, with reports that would even be as bad as Spanish influenza. Now in the end it was deadly, but absolutely nowhere near the level of other global pandemics. I believe the final toll was about 28,000, which is bad, but to put things in context, Spanish influenza killed up to 50 million people, and AIDS so far has killed somewhere in the region of 30 million. The Asian flu of the late 50s, I believe it was, killed about 1 million. Hong Kong flu in 1969 killed 1 million. The Black Death was the biggest killer in human history, that spread from China to Europe in the mid-14th century. That killed an estimated 100 million people, a massive proportion of the world's total population at that time. Half of England's population, to narrow it down into that context. But I think one of the key things about these sort of health outbreaks, these virus outbreaks, is not to have balanced sort of reporting, to have a balanced perception of it, because I think the chances of there being mass deaths in other continents are extremely unlikely. Of course, when it comes to health and when it comes to viruses, there's, like I said, this is not my field, but I think that scaremongering is not the right approach either. So far I'd say the media's been quite responsible with this. They haven't been scaremongering so far, but it's important to get that balance right. Of course it needs to be reported. It is an important issue. It is historic because it's the biggest Ebola outbreak ever, but it's not yet at the level of a pandemic. I mean, to be a pandemic, I would have thought, like I say, this isn't my field, but I would have thought there would have had to be at least millions of deaths to be considered a worldwide pandemic. What I do find a little troubling is that this is being compared to the AIDS virus, in the sense that the way it is being transmitted from human to human through things like cuts and so on. If that's the case, that is something that should certainly be worrying. But I think it's all about balance. So let me know your thoughts on this. Are you worried about it? Do you think it's blown out of proportion? Do you think West Africa countries are doing enough to combat it? Let me know your thoughts.